Hello, everyone. My name is Marissa Tucci. I'm a second-year medical student at Tulane University School of Medicine. I'm honored to be speaking with you today, and I'd like to start off by acknowledging my fellow authors, Carleigh Schley, Lauren Mueller, Dr. Crystal Broussard, and Dr. Jessica DeBord. Today, I'll be presenting our research on challenging the social determinants of health through an interprofessional home visit curriculum. I will begin by providing some background on the topic, then delve into the structure and objectives of our program before outlining the outcomes and conclusions that we have drawn. The role of health professionals in academic health centers in addressing health inequities is relatively new and continues to evolve. This calls into question the best way to implement the teaching of social determinants of health into medical education. Like much of clinical medicine, the intricacies and real-world implications of such topics cannot be appreciated from a lecture or a textbook. An understanding of health disparities requires experience in one's community alongside residents who face these barriers. Despite the strides that have been made in the field, longitudinal, interdisciplinary, community-based preclinical education is lacking. The Social Context in Medicine elective at Tulane University School of Medicine aims to prepare students to challenge health inequity through an experiential curriculum centered on community engagement and interprofessional team-based care. Care teams are comprised of medical, social work, and law students who work collaboratively to begin addressing barriers within our community. In addition to educating students about the social determinants of health, the Social Context in Medicine program, or SKIM, aims to improve cultural humility, teamwork skills, interdisciplinary collaboration, and student understanding of the patient perspective within our healthcare system. So, how does an elective course address these objectives? The SKIM curriculum spans 18 months and is comprised of two phases. Phase 1 begins in the first year of professional school. Students attend a series of seminars and workshops that serve as an introduction to the social determinants of health and other pertinent topics. Previous seminars from experts in the field have covered topics like barriers to care, implicit bias and cultural humility, trauma-informed care and ACEs, and collaborative care. By the end of phase 1, students are prepared to partner with a community member and begin participating in monthly home visits. In phase 2, small student teams conduct monthly home visits with their assigned patient. During the visits, students provide basic health screenings, counseling and patient education, and assistance navigating the healthcare system. Law students conduct screenings and facilitate connections with free legal services when needed. Outcomes. To assess the effectiveness of the SKIM curriculum in achieving the program learning objectives, SKIM participants are surveyed after each phase. Data collected from these surveys suggests that SKIM equips participants with the knowledge and skills required to address common barriers to health in our community. Students reported that phase 1 provided valuable insight into patient-centered care and interdisciplinary collaboration that will influence their future practice. Following phase 2, students endorsed that the clinical experience and care coordination skills developed during the program prepared them for their clinical years. In conclusion, survey responses support the potential of SKIM to positively influence the knowledge, skills, and attitudes of preclinical medical students as they relate to the social determinants of health and inequities. The experiences of SKIM participants suggest that the program may prepare students to become advocates for under-resourced populations within their community and for their future patients. To wrap up, in the future, we hope to assess quantitative educational outcomes, such as those measured in the AAMC graduate questionnaire and that are reported by residency directors. And importantly, program leadership is exploring options for measuring the patient experience in SKIM through satisfaction surveys and markers of health, such as utilization of preventative, emergency, and hospital healthcare services. Thank you so much for your attention, and please let me know if you have any questions.